Hey, it's Dr. Nuesse here again, and today we're actually doing a request video. This request was posted in the comments of one of my other videos. So today, the subject at hand is how do ketogenic diets specifically affect blood pressure specifically? And I'm going to focus on one research article that I found really interesting. Again, there's tons and tons of research showing a link between losing weight the right way, especially losing body fat, which the ketogenic type of diet is very good at doing, and the positive effect it has on things like blood pressure, diabetes, and things like that, the health conditions. So the research study that I want to illustrate today compared doing a low carb diet, which we all know is the ketogenic type of diet, with taking a very specific drug, orlistat. So what orlistat does is it prevents your body from absorbing fat that you eat. So as we know, as many of us know, eating fat isn't really the issue. It's not really what makes you gain body fat. The issue really is too many sugars, especially refined sugars, refined carbohydrates. So here's what the study showed, and this was published in the Archives of Internal Medicine, that low carb diets, again, which we know as the ketogenic type of diets, led to a 50% reduction in a patient's blood pressure medication usage. So the usage of blood pressure medication on patients that were on medication was cut in half by doing this type of diet over the period that they did the study. And that's compared with this drug orlistat, which was used on the other half of the participants in the study. They had a 21% decrease in the usage of their blood pressure medications. So just doing the low carb diet and taking weight off in that way led to a much better result than even using a drug. So that goes to show you that the power of the ketogenic way of losing weight and especially burning body fat, and how that affects specifically blood pressure. Now, there's some information out there, and I think it's misinformation, saying that ketogenic type of diets can actually increase your blood pressure, and that's on this side of the board here. So we have seen in our office temporary increases in blood pressure, and that's due to the stress response. It's an adrenal response. There's stress glands when you go through a change. Stress hormones are secreted, adrenaline and cortisol, and those can elevate your blood pressure temporarily as you adjust to this new way of living, this new diet, this new way that you're going to be trying to lose weight. So there's an adjustment period, and that is temporary. Let me illustrate the fact that this is a temporary response. So that will work itself out. There is some risk, and that's here, this last point, there's some risk that if you're changing your diet and you're really increasing your salt intake, which does happen sometimes on ketogenic type of diets because people are changing so significantly how they're eating that they want to just salt everything. There's a minimal amount of risk that if you really drastically increase your salt intake, that can have an effect on your blood pressure. But I think the weight loss that comes along with doing a diet in the correct way, and specifically we're talking about low carb diets here, drastically outweighs the little bump or the chance that you could elevate your blood pressure, again, temporarily, or by not dieting exactly correctly, or imbalancing your electrolytes basically. So again, just a short video on a request. I hope that you enjoyed it. If you did, please hit that thumbs up button. Subscribe to this video. We're putting videos out at least once a week, and hit the little bell notification next to the subscribe button. If you have any questions about this topic, leave those in the comment section below, and I will address those as well. Until next time, stay happy, stay healthy, and I will catch you in the next one.